Before we start, I want to ask you something. When was the last time you went a full day without thinking about your heart? Not in a dramatic way, just quietly, wondering if your blood pressure is getting worse, if your arteries are aging faster than they should, if that tight feeling in your chest means something or nothing. Because for millions of adults over 60, heart health stops feeling abstract. It becomes personal. And here's what shocked me after years in cardiovascular medicine. Some of the most meaningful improvements I saw in older patients didn't begin with some breakthrough drug. They began with small habits, simple foods, repeated consistently. Today, I want to talk about one food that cardiologists themselves eat regularly for heart health after 60, and why researchers believe it may help support aging arteries in ways most people never hear explained properly. But first, I want you to answer something honestly in the comments. What worries you more as you get older? Heart attacks? Strokes? Or slowly losing your energy and independence? I genuinely read the comments, and I think a lot of people watching this feel less alone when they realize others share the same fears. Now let's talk about the food itself and why the science behind it is far more interesting than most headlines make it sound. There's a moment that happens to many people in their 60s and 70s, not all at once, gradually. Maybe you notice you get tired walking uphill now. Maybe climbing stairs feels different. Maybe your doctor says your blood pressure is a little higher than last year. And suddenly something changes psychologically. You begin realizing your heart isn't just something keeping you alive in the background anymore. It's something you think about, something you worry about. I remember speaking with a man in his early 70s at a community health event years ago. He looked completely fine on the outside, but he told me something I never forgot. He said, "Doctor, I'm not scared of dying suddenly. I'm scared of becoming weak slowly." And honestly, I think a lot of older adults understand exactly what he meant. Because people don't just want more years. They want strength, mobility, energy, independence. They want to keep living their lives without feeling fragile. The problem is that most heart health conversations are incredibly reactive. People wait until something goes wrong, then the panic begins. But researchers now understand that cardiovascular decline is often happening quietly for years underneath the surface. Inflammation, oxidative stress, stiffening arteries, reduced blood vessel flexibility, tiny changes building year after year, which means supporting the heart before catastrophe happens may matter more than most people realize. And this is where the research around fatty fish becomes incredibly important. The food we're talking about today is oily fish: salmon, sardines, mackerel, herring, anchovies, and yes, I know, some of you just made a face when I said sardines. Stay with me. Because this isn't about trendy dieting, this is about biology. Inside fatty fish are omega-3 fatty acids, especially EPA and DHA. And researchers have spent years studying how these compounds interact with the cardiovascular system. What they discovered was fascinating. As we age, inflammation inside the body tends to increase. Not dramatic inflammation you can feel immediately. Low-grade, chronic inflammation, the quiet kind, the kind that slowly irritates blood vessels over time. Researchers believe omega-3s may help calm some of those inflammatory pathways. And that matters because inflammation is deeply connected to arterial damage and cardiovascular disease. But there's another reason experts pay attention to this: arterial stiffness. Healthy arteries are flexible. They expand and contract smoothly as blood moves through them. But aging, stress, poor diet, smoking, and years of inflammation can gradually make arteries more rigid. And when arteries stiffen, the heart has to work harder. Several studies suggest omega-3 rich fish may help support vascular flexibility and healthier circulation. Again, not a miracle cure, not magic, but meaningful support for an aging cardiovascular system. And honestly, this next part surprised many researchers. The benefits often appear especially noticeable in older adults. Why? Because older arteries have experienced decades of wear and tear. So nutritional support may create a more noticeable difference compared to younger populations. That's one reason many cardiologists quietly prioritize these foods in their own diets, not because they think fish is some magical solution, but because the evidence supporting it has become difficult to ignore. Now here's where many people accidentally get this completely wrong. Mistake number 1, thinking fish oil pills are exactly the same as eating fish. They aren't. Whole fish gives your body the complete nutritional package: protein, minerals, natural fats, selenium, vitamin D, everything working together. And unfortunately, many cheap fish oil supplements are low quality, poorly absorbed, or heavily processed. That doesn't mean all supplements are bad, but researchers still consistently favor whole food sources whenever possible. Mistake number 2, choosing the wrong fish. A lot of Americans eat fish regularly, but not the kinds researchers are actually talking about. Breaded frozen fish sticks? Not the same. Deep-fried fast food fish sandwiches? Not the same. The heart health research focuses mainly on oily fish rich in EPA and DHA: salmon, sardines, mackerel, herring. Those are the heavy hitters nutritionally. Mistake number 3, cooking healthy food in unhealthy ways. This happens constantly. People buy beautiful salmon, then deep fry it in refined oil and serve it beside ultra-processed foods. And suddenly, the meal contains the very inflammatory compounds they were trying to avoid. Simple preparation usually works best: baked, grilled, lightly pan-seared, olive oil, lemon, herbs. That's enough. And mistake number 4, thinking it's too late. Please hear me clearly on this. Your body continues responding to healthier habits even later in life. Your arteries are still biologically active in your 70s and 80s. Inflammation is still responsive to nutrition. Blood vessels still adapt. No, healthy eating won't erase decades overnight, but meaningful support absolutely still matters. And many seniors underestimate how much better they can feel from small, consistent changes. So let's make this practical, not overwhelming, not extreme, realistic. Start with 2 fish meals this week, just 2. If fresh salmon feels expensive, canned salmon works. If cooking feels exhausting, sardines are incredibly convenient. Honestly, many nutrition experts consider sardines one of the most underrated foods in modern diets. Cheap, nutrient-dense, loaded with omega-3s. Now pair those meals intelligently. Add dark leafy greens, spinach, kale, arugula. Use olive oil instead of heavily refined oils when possible. Add berries occasionally, a handful of walnuts in the morning. Notice something important here. None of this is extreme. That's intentional, because extreme routines rarely last. Simple routines do. One thing I've noticed over the years is that healthy older adults usually don't rely on dramatic bursts of motivation. They rely on repeatable habits, small things, done consistently. And consistency matters enormously when it comes to cardiovascular health, because arteries change slowly, inflammation changes slowly, blood pressure trends change slowly. The body responds to patterns, not one perfect meal. And honestly, there's something emotionally comforting about that, because it means your health is not determined by one bad week or one unhealthy dinner. Your future health is shaped mostly by what you repeatedly do over time. Now I want to be responsible and clear. Nothing in this video replaces professional medical care. If you have heart disease, if you take blood thinners, if you've experienced a cardiac event, or if you're managing serious medical conditions, please talk with your physician before making major dietary changes or adding supplements. And if you experience chest pain, shortness of breath, dizziness, or heart palpitations, please seek medical attention immediately. Don't rely on YouTube videos for emergency medical decisions. The goal here is not replacing medicine. The goal is supporting your cardiovascular health with evidence-based habits that work alongside proper care. That's the safest and smartest approach. You know what's strange? Most people spend their younger years assuming the heart will just keep going forever, beat after beat, year after year, quietly, without asking for much. Then one day, usually later in life, people suddenly realize how hard that heart has worked for them. Through stress, through loss, through raising families, through sleepless nights, through decades of carrying the weight of life. And honestly, I think that heart deserves care in return. Not perfection, not fear, just better support, better fuel, better habits, more consistency. Because healthy aging is rarely about one massive decision. It's usually the result of hundreds of tiny choices repeated quietly over time. So maybe this week, your first step is simple. 2 fish meals, a morning handful of walnuts, a short walk after dinner. Small things, but small things become years, and years become quality of life. If this video spoke to you, share it with someone over 60 who matters to you. And before you go, I'd really love to know, what's one health change you wish you had started 10 years earlier? I think your answer might help someone else reading the comments. Take care of yourself and take care of that heart.